Nowadays, male fertility issues account for over one-third of fertility problems. So you need to understand and address these factors because they are crucial in supporting your journey towards conception. Let's understand what exactly happens under normal conditions when there are no male fertility issues. Under normal conditions, within the male reproductive system, sperms are produced in the testicles and go into a tube situated behind the testicles known as epididymis. Just before ejaculation, sperm go into a set of tubes called vas deferens, which are situated just behind the epididymis. These tubes then join the seminal vesicles. They contribute seminal fluid to semen, providing nutrients and substances that support sperm viability and motility. The semen thus formed travels through the urethra and out of the penis during sexual intercourse. Overall, we can say that male fertility depends on the sperm production and its delivery. Sperms go into female partner's vagina, travel through her cervix, which is the lower end of the womb. When they reach the uterus and finally to the fallopian tubes where an egg and sperm meet each other. Also, this is the place where the fertilization happens. But this system works well only when genes, hormones and environmental conditions are right. If you think that sperm count is the only factor related to male fertility, then you are wrong. A person must have overall healthy sperm. So what is healthy good sperm? We shall check it out in this video. A sperm's health depends on three major aspects such as structure, amount or concentration of the sperm, movement. When I say the structure of the sperm, it means a sperm with an oval head and a long tail. It is considered to be normal sperm because it has better movement. The quantity, amount or the concentration of the sperm in a single ejaculate should not be less than 15 million sperms per milliliter. If this count is lower than this margin, there will be a reduced pool of potential sperms available to fertilize the eggs, and it reduces the chances of pregnancy. So a sufficient sperm count is essential for maximizing the chances of successful conception. Movement or motility of the sperm is the crucial movement required to reach and fertilize the egg. Sperms are excited to swim through the cervix and reach the fallopian tube, but this needs a lot of energy. So if at least about 40% of the released sperms are highly motile, the chances of conceptions are higher. Now, how do we understand if the sperm is healthy? This is why semen analysis is done. Semen analysis is not only a fertility test, but it also done as a guide to understanding sperm health because it helps to show the level of sperm production and if it is functioning well. So the process starts with the collection of semen by masturbation into a sterile cup. This is not the only way to collect the semen because of some of you may not be comfortable. In such cases, there are alternate methods to collect the sperm, such as special condoms that are used during intercourse. The sample will be then analyzed using standardized methods to analyze different aspects of the sperm health, such as total number of sperms, the fluid volume, sperm concentration, and the nature of the sperm based on which sperm quality will be decided. Now we need to understand the parameters of semen analysis. The volume of the semen taken should be 1.5 milliliter at least. The concentration should be 15 million sperms per milliliter of the semen. The total number should be 39 million sperms per ejaculate. The motility of the sperm should be 40% and the progressive motility should be 32%. Progressive motility means the sperm should move in a straight line or large circles. Around 4% of the sperm released must be in the normal form. This means they should have an oval head followed by a tail. About 58% of the sperm must be vital, which means they should be energetic to sustain until they encounter an egg and get into fertilization. Semen color. Normally the semen color is translucent or whitish grey. If it is greenish, yellow or reddish, then it is clear that the sample is abnormal. Altered characters, in case you notice things such as semen is being too thick, foul color or too watery, it means the sample is unhealthy and the issue needs to be addressed. Usually if your results are normal, then only one sample is sufficient. Suppose the semen analysis is normal and even then your partner is not conceiving, in these cases the tests are conducted on your female partner before any more fertility tests are conducted. In case your results are abnormal, Then a repeat analysis is performed after 3 months or sooner because the sperm count may vary with time. Low sperm count is not the end. Yes, even if there are low sperm count or no sperm, it may not mean you are permanently infertile. Sometimes it will just show the problem with the growth and delivery of the sperm. So in these patients, further testing is necessary. Never lose hope because even if no sperm is found, the treatment is still there in some cases. Low volume indicates blockage or inadequate sample. It could suggest retrograde ejaculation and dysfunction in the seminal vesicles or prostate. Here, retrograde ejaculation means the condition where semen enters the bladder instead of emerging through the penis during the sexual intercourse. It is already mentioned that the healthy sperm concentration is 15 million per milliliter of the semen sample. So if this count is below 15 million per ml, then such a condition is known as oligospermia. Now let's talk about how to produce healthy sperm. Is there anything you could do to resolve the issue on your own or support the treatment your doctor has given? Yes, definitely. Maintaining healthy weight. Increased BMI is associated with reducing sperm count and motility. So you should focus on reducing your weight or gaining weight to achieve your ideal body weight. What is ideal BMI in a male? It's between 18.5 and 24.9. Eat a healthy diet. A balanced diet with vegetables and fruits rich in antioxidants is recommended to healthify the sperm. You can consider using mineral oils or mustard oils because they enhance the fertility. Also avoid processed meat, full fat dairy products, coffee and sugar sweetened beverages as they have a direct impact on your weight gain. Ashwagandha, fenugreek, it has been used as a natural remedy for poor sperm health. Antioxidants and omega fatty acids also boost male fertility. Sexual transmitted disease such as gonorrhea and chlamydia, they cause the fertility problems and they decrease the semen count and motility. Manage your stress levels. Stress can reduce sexual function and reduced hormones need to produce good healthy sperm. Though exercising is good, but too much exercise can also harm the sperm health. So keep it moderate. Walking in nature, adequate sleep and spending time with family and friends can help you manage stress. Increase frequency of sex during ovulation. Having sexual intercourse every day or alternate day 5 days before ovulation increases the chances of pregnancy. So you should be knowing the days of ovulation and plan accordingly. Women are likely to become pregnant during ovulation, which occurs in the middle of the menstrual cycle. So talk to your partner about this, note the dates, days and try to have sex on those days without fail. Avoid uses of lubricants. If you are using products such as KY jelly or saliva as a lubricant, you should know that these may weaken or damage the motility of the sperm. In such cases where you require the lubricant, you can check with your doctor for a sperm-safe lubricant. Medicines to avoid. There are some medications like antidepressants, opioids or anti-androgens that lead to fertility issues. Anabolic steroids and illicit drugs uses also have this impact on the male fertility. You should avoid smoking and alcohol consumption. These habits lead to lower sperm count. Moreover, if you are addicted to alcohol intake, it decreases the testosterone level and leads to impotency. You also need to avoid certain things such as wearing the same clothes for a long time and not taking a shower after exposure to metals, solvents, pesticides and paints as they may affect the sperm. Avoid biking and bicycling for more than 5 hours per week. Avoid sports injury to your groin area, which is the area in the body where the upper thighs meet the lowest part of the abdomen. Also maintain a cool environment for the scrotum. Scrotum is a male reproductive structure located under the penis. When there is an increase in scrotal temperature, sperm production is either delayed or completely stopped. So you must use boxers or loosened cotton briefs instead of synthetic ones. This type of clothes will help in airflow and temperature control to the scrotum, cultivating the right environment for healthy sperm count. Also, you need to reduce sitting for too long, reduce using a hot tub and limit scrotal exposure to warm objects such as laptops. In conclusion, understanding male fertility issues is crucial for couples aiming for parenthood. From the complications of sperm production to the significance of sperm health, various factors influence fertility. Semen analysis serves as a guide highlighting aspects vital for conception. By addressing the factors that affect sperm health and following the mentioned changes in this video, couples can enhance their chances of successful conception. Remember, seeking professional advice is essential. Take proactive steps towards reproductive well-being for a fulfilling journey to the parenthood.